Senator Kay Kirkpatrick serves as chairman of the Senate Ethics Committee and as a member of the Senate Health and Human Services, Insurance and Labor, and Veterans, Military and Homeland Security Committees. She is also a member of the Commission on Family Violence and has been an orthopedic hand surgeon in Atlanta for over 30 years.
I am very happy to be with you to celebrate an important day for substance abuse prevention. And I wanted to talk a little bit about what I'm working on and kind of what's going on at the Capitol. I am Senator Kay Kirkpatrick. I represent Senate District 32, which is East Cobb and Sandy Springs. So I have Cobb and Fulton counties, but obviously all of us down here represent everyone. My committee assignments fit very well with my background. I'm an orthopedic surgeon, and when I retired in 2017, I was asked to move into this arena, and I did that. And it's been very challenging and interesting, but I'm on the Health and Human Services Committee, the Insurance Committee, which is great because those two really go hand in hand. And then I also work a lot on veterans and military issues, and I'm chairman of that committee in the Senate. And I'm new to the Judiciary Committee this year, which is really a great learning experience, and hopefully I'm able to bring a different perspective to that committee. And I work on the health subcommittees for appropriations, and obviously our budget is a huge part of what we do down here. I work with a lot of people in my counties on prevention and recovery issues, and I would have to say that Cobb County in particular has been a leader in this area. And so I've been happy to work on several things to help us with the additional problems that we're seeing about substance abuse during the pandemic. We're seeing increases in mental health issues, addiction, and also suicide. And so those things have really become a front burner issue down here. And I think our budget is going to reflect that as well. In terms of bills that I'm working on, I have two that I think are relevant to you guys. One is Senate Bill 4, which really prohibits patient brokering in the substance abuse treatment and recovery industry. And what we've seen in this is some bad actors coming to Georgia after Florida passed a law on this a few years ago. And this bill basically says you can't pay for referrals, which, duh, that's the federal anti-kickback law, but we need it at the state level too. And that bill has passed the Senate, and it has gotten through the Insurance Committee on the House side. So I'm optimistic that that one is going to make it across the finish line this year. I tried to get it done last year, and it got hung up because of our COVID issues. And so that one is well on its way. I've got another bill that is probably something y'all will be interested in that may have a tougher time. It's Senate Bill 80, and that is a bill that relates to prior authorization, which is the approval process for medical treatment, including testing, surgery, drugs, really everything. And that industry really operates behind a curtain. And the bill is designed to try to bring some transparency to that industry and also put some guardrails around the timelines, who can make those decisions, and getting access to the criteria that are used for healthcare providers. So that bill has passed the Senate also. It will go to the House Insurance Committee, but because we have crossover day on Monday, it won't get heard before earliest next week. So I'm still working on that with a lot of stakeholders, but it's an important bill, and it relates to people that are working on prevention as well as treatment in the area of substance use. I've worked a lot with folks on preventing problems before they start over the last few years. And there are several groups that are focused in this area. And what I like to see down here is coalitions. I like to see different groups working together because that pulls more people into the effort, more constituents into the effort. And I will talk just momentarily about our process down here. It's very hard to get bills passed, but you can have an impact on that. And the best way to do that is to know who your legislators are and contact them and let them know how you feel about various bills, budget, other bills. And I would recommend to you that you get familiar with the legislative website, which is legis.ga.gov. And that will take you to your representatives. It'll also allow you to follow bills as they go through the process. And it has a video component. All our committee hearings are live streamed and archived along with our chamber proceedings. So it would be worth your time to get familiar with that website and to reach out to your senator and your representative along the way as things come up that you're interested in. I also think there are a few rules of the road for that might help you. I will say that calling right now is tough because we're all getting lots and lots of calls and can't keep our voicemails cleared out. So email may be a little better at this particular moment in time, but most of us find individual personal emails to be more useful than blast emails, just because we're all getting a lot of volume, and people that live in our districts that take the time to do a personal email usually have a better chance of getting noticed in the hundreds of emails that are coming through every day. Anyway, I support the effort to stop our problems before they start. I spent most of my career working on patient safety issues, and we know that once people get into a situation of addiction, treatment, recovery, that becomes a lifelong battle. And how much better if we can just provide education to people of all ages, especially kids, to keep this from ever becoming an issue. I'll mention one more thing. I'm actually working with a Girl Scout troop on vaping legislation. And this is an example of what I'm talking about. The bill that I'm working on was Representative Bonnie Rich on the House side has passed the House. I'll be carrying it in the Senate. It's House Bill 287. And it provides for education about vaping along with tobacco and alcohol in our school health classes. And I think our kids are the key to getting a handle on this situation that we find ourselves in, which, as I said, has gotten much more problematic during the pandemic. So I hope that you'll take a look at that. I think that has a very good chance of succeeding this year. We work in baby steps down here and don't always have the ability to fix a problem right out of the gate. Some things take several years, but I really appreciate what you guys are working on and your support and your championing the issues related to prevention of substance abuse problems. And please let me know if I can help you. I'm very easy to find. My email is on the Senate website, but it's k.kirkpatrick@senate.ga.gov. And because I'm on the committees that are relevant to this, I'd be happy to help any way that I can. Thanks very much, and congratulations on your special day.